Good morning and welcome to your Aging Resource Center, your local area agency on aging. This is a beautiful August 16, 2012, and we are here hosting a senior discussion with Secretary Sebelius of Health and Human Services Department of our country. I'm excited. We as an organization serve seniors, we serve caregivers, and adults with disabilities. We do that in 5 counties. That's right. Palm Beach, Martin County, St. Lucie County, Indian River County, and beautiful Okeechobee, as one of my advisory council members says. And I'm very happy this morning to also welcome our mayor, Jerry Moyle. Let's join her as she is already welcoming everybody here to West Palm Beach.
A woman who used to work for me, her husband got a great new job in Miami. And they set off to Miami, they bought a house, they were ready to move, and she found that she couldn't get insurance because she had been a breast cancer survivor. So she wasn't able to get insurance because she had a pre-existing condition. And as a result, they sold the new house in Miami, came back to West Palm Beach, and they're still here. Well, we're happy they're still in West Palm Beach, but that's just an example of the kinds of stories that we hear every day, and I'm sure, Madam Secretary, you must hear that all the time. So we're very anxious to hear from the Secretary about all of the good things that are happening and how they are going to affect you as seniors, especially seniors in West Palm Beach. So thank you for being here, and enjoy the morning.
All right, I want to say a welcome again. Our audience here this morning is made up of seniors, of caregivers, and providers. And I am so glad that we can come together because we really are embodying what the Affordable Care Act is all about. Bringing together and integrating the community-based services and supports, and also being able to bring the medical services together. And you know, my wife, for the last 20 years, has helped me caregive my mother, who passed away at 99. She helped me with my father for 7.5 years in our home, and now he's in a beautiful little assisted living, I told the mayor, right here in West Palm Beach. He's happy as a lark. And now we're once again caregiving for my wife's father, which is the whole reason we came to Florida in the first place. What's interesting is, I have to be honest and confess, my wife has been the one that has really done most of the caregiving. And guess what? She's put herself last a lot of times and hasn't taken care of herself. And I thought, oh my lands, preventive services in the Affordable Care Act are so critical to caregivers. That's a big deal. And especially to women who do most of that caregiving. And I'm so glad that we have a woman who is the health manager for the country. And she is here with us today.
Good morning, everybody, and thank you so much, Jaime. I'm delighted to have a chance to be here in West Palm Beach, and also to be here at a great area agency on aging. Wonderful work is done by agencies like this, not only in Florida but all over the country, and they are really essential service providers. So thank you for convening this conversation. I want to thank the other panelists who you'll hear from in a few minutes in terms of their individual lens on how this law is impacting their work, their business, their clients, their lives. And I'm just here to share a little overview with you. Like Jaime, all of us have sort of personal connections with Medicare. I begin with my father, who is 91, and he actually was in the United States Congress when Medicare was passed. He sat on the Energy and Commerce Committee. He helped to write the law. And now at 91, he's pretty glad he did. He's a beneficiary of a lot of the services and supports. But when I think about the 49 million Americans who are Medicare beneficiaries, I always start with my dad, as all of us do. Jaime talked about his family situation and his family caregiving situation, and that's pretty typical. The vast majority of caregiving in this country is done by family members, so certainly help and support for those individuals is really important. It's been about 2.5 years since President Obama signed the Affordable Care Act into law, and I think that it is one of the most important laws passed in the last 45 years that impacts the future of Medicare and strengthens Medicare. And I just want to talk about that lens for a minute. We have millions of Americans already who have begun to see these benefits and begun to take advantage of them in their own lives. And I do a lot of traveling around the country, and one of the things we're trying to do is make sure people know how the Medicare law has changed, how the benefit package has changed, so that they really can access some of these services. So it includes lower prescription drug costs, particularly for seniors who are taking the most medications. Seniors in the past hit the so-called donut hole, the gap in the Part D prescription plan, that when you had taken so many medications, when you'd spent money, you reached actually a gap in your prescription drug coverage, so that 100% of the drugs in that donut hole gap were paid out of pocket. And I can't tell you how many times I heard from people who just said, we just stopped taking our medicines. We stopped filling our prescriptions, we're cutting pills, I'm supposed to take 5 and I can only fill 3 at a time, or I'm taking them every other day instead of every day, or I'm cutting them in half. So the discount right now in the donut hole of 50% on brand name drugs has meant for Floridians that they're getting back about $630 each. That's a huge savings in real dollars in people's pockets, and is allowing folks to actually go ahead and purchase drugs. Over the next several years, that donut hole gap will disappear altogether. That's part of the framework of the law. There is now, Jaime referenced the preventive services. So part of the framework is, one of the ways that you lower overall costs in healthcare is actually keeping people healthier in the first place. Not waiting until folks get sick and treating the sickness, but actually looking at wellness. So for Medicare, seniors now can access preventive services with no copays and no coinsurance. And that includes everything from important cancer screenings, mammograms, and colon cancer screenings, to an annual wellness visit. Medicare always has included a one-time welcome to Medicare visit, but now there's an annual update where a beneficiary and his or her healthcare provider can sit down and make a plan for the future. You know, what's going right, what's going wrong, not wait till you get really sick, but actually go in for a checkup. Flu shots are also available, and a whole host of preventive services that people used to pay out of pocket. And again, the financial barriers for prevention care might have discouraged some folks from actually getting the care that they needed, getting the checkup earlier, and saving not only health days in the long run, but saving dollars in the long run. So we know that in Florida there are about 1.2 million Floridians who have already accessed those preventive services last year, and have done that without a copay. And people are beginning to take advantage of the wellness visit opportunity that's there. The other thing that the law has done, the Affordable Care Act has done to strengthen Medicare, is really give us new tools to go after fraud. Unfortunately, Medicare spends a lot of money each year. There are a lot of providers enrolled and involved, and that's good. Those are doctors and service providers and hospitals and nursing homes and home health services. But unfortunately, as they always said, you know, when you have resources involved, you also attract fraudulent activity, and there is a substantial amount of fraudulent activity in some services. So the Medicare law has been strengthened. We have doubled the penalties to go after folks who are committing fraud. We have new tools, and Florida has some of those assets here on the ground where we have tripled the number of what we call them strike force teams. These are law enforcement agents who work on the local level, and they are working closely with U.S. attorneys and state attorney generals to really look at billing practices and be able, with boots on the ground, to go after these folks. What that effort has done is in the last year, we were able to put over $4 billion back in the trust fund from fraudulent activities that were stopped or prevented, and that money is now going to go pay for medical services. So it's all strengthening the framework while guaranteeing the benefits that seniors have always looked forward to. Medicare has been a commitment that a whole range of health services would be available. Now that's a pretty stark difference, frankly, from the House-passed Republican budget, which would actually, by repealing the Affordable Care Act, take away the preventive services that I've just described, take away the wellness visit, eliminate the new tools to fight fraud, the new prescriptive modeling tools that we have, the new strike forces. Those are all part of the Affordable Care Act. That would cease to exist day one. They would slash Medicaid funding, and Medicaid is a critical program paying for nursing home care and home health care for a number of low-income seniors. That would also start day one. And then with Medicare, we would actually change the guaranteed benefit package to a payment package. And what every neutral analyst has indicated is, yes, the federal government would spend less on Medicare, but they'd spend less by shifting those costs to seniors. So on average, seniors would be paying about $6,400 additional dollars out of pocket just to get the same benefit package that they have right now. So costs would go down for the federal government. The underlying costs don't go down. They just get shifted onto the beneficiaries. So it's a very different view of how you strengthen Medicare going forward. We think that the current framework of new tools, new resources, guaranteed benefits, and protecting the trust fund by an additional 8 years, which is what the Affordable Care Act has done, is the way to go. So I'm, again, delighted to be here, anxious to hear the conversation from our providers and beneficiaries who are on the panel today, and want to, again, thank Jaime for having us here.
Before I introduce the panel, I just want to make a couple of comments about this morning, just so you know. One of my wonderful advocate friends asked me first thing, we're going to be able to ask questions. And no, you won't be able to this morning. The reason for that is, number one, is the scheduling. And number two, the secretary really did want to have us witness a conversation with folks, a discussion. And you'll see that this is not your typical panel. I'm not going to try to have like a moderator role. I'm really going to try to be a facilitator, but they're going to talk. And the secretary, and everybody may ask questions of themselves. So please know that, number one. But here's the good news. The secretary has also made sure that we have someone here from HHS Regional, and I believe it's Teresa Zayas. Would you stand? Oh, let's recognize her. And if you got a question that something just really hit you, you see Teresa. And also, where's Jennifer Vandermeer and my Shine volunteers? Where are you? Right there. These folks also, they're available. So they'll be, Jennifer, can we have you maybe exactly where you're at in that area, where people can just come over if you have questions. So just wanted to let you know that. All right, I want to introduce the panelists right away. First off, we've got Dr. Mary Colburn, who is a geriatric physician, and she's much more. She's a community advocate. We have Carol Berman, who's going to be speaking on the donut hole this morning. And we've got, here's Cookie. You're right. That Miami traffic is killer, isn't it? I'll introduce you in just a moment. Joyce Brown will be dealing with preventive services and benefits. And Cookie, who just arrived in time, perfect timing, is caregiver, like many of us, of a parent. And then we've got Leonardo Scarpiti, I call him Leo. Leo, is that okay? Leo, he's with Senior Medicare Fraud, and that's exactly what the Secretary was just talking about. So without any further ado, I'm going to start with Dr. Colburn.
Thank you. Pleasure to be here. Most seniors want more time with their physicians. You hear that, you believe it, I believe it. So it's important to talk to your physician about your health, how to stay healthy, how to prevent illness, how to delay disability. But if the physician is not awarded reimbursement, and if their time is not valued by spending and talking about preventive services, rewarding their expertise and time, what's the incentive? Why would that physician do that, even though it's the right thing to do? With the Affordable Care Act, now the value is recognized. The annual visits, the annual wellness visit, you can sit down with your physician, plan your future, stay healthy, and the physician is recognized.
Wow, that's incredible. Do you want to make any comment on that? That just, you're able to talk to them.
Yeah, previously, I was not reimbursed to talk about wellness. Medicare was a sick insurance plan.
And I think Dr. Coburn is absolutely right. You know, we had, I like to say to folks, we had a really good sickness system, but not a very good health system. Because if you, an example that I like to use is Medicare would pay, and this is a fairly drastic case, but it's pretty, I think it illustrates what Dr. Coburn is talking about. If a diabetic who had problems with lower extremity circulation, which often occurs if the diabetes isn't under control, there would be a series of situations where if in the dire result that person needed an amputation, Medicare would certainly pay for the hospitalization, pay for the amputation, pay for the follow-up care, pay for the, they did not have much focus on the steps that led up to that. So that, I mean, if you think about that situation, it made no sense. Much better to intervene at a very early stage and actually prevent that in the first place. So Dr. Coburn's expertise, you might talk a little bit about the kinds of things that you saw with folks and what you can now do in terms of particularly dealing with chronic disease or helping folks to manage illness. If they would wait until the end to come in, what you would see and what difference that could make.
Certainly, I had a new patient recently, 81 years old, living independently as a widow, living in Century Village, relatively healthy, hypertension, mild diabetes, some osteoarthritis of the knees. And during my initial appointment with her, I said, have you ever had a bone density? She said, no, I don't recall that I've had one. I said, well, it's important to have one to see if you have osteoporosis. So at the end of the visit, I gave her prescription for a bone density, and I got the report within 2 weeks. She was diligent. And
Again, a preventive service covered now under,
Yes, thank you.
with no copay, no deductible.
So no deterrent for her as far as financially. And she was diligent. I had the bone density, I had the report, it showed osteoporosis. Before her next visit, which was coming up, unfortunately she fell in her home, broke her hip. So, you know, I thought, what could have we done differently? I mean, here's an 81-year-old independent, broken hip changes your life immediately. And for many people, forever. We could have educated sooner. During that annual wellness visit, talked about calcium, talked about vitamin D, talked about exercise, and get that bone density earlier, age 65. Maybe it would have shown pre-osteoporosis, and then we could have started medication.
Wow.
But we'll pay for the hospitalization, we'll pay for the surgery, pay for the nursing home.
What a perfect lead-in for Joyce. Joyce, to talk about preventive services.
Guess what? They did it to me, and I'm taking my vitamin D, and I'm taking my calcium, and I'm reversing the early stages of, I think they called it osteopenia or something like that. I'm very fortunate to have a doctor who recognized the Affordable Care Act immediately and began giving me the screenings immediately. As soon as it was available, I got it. very grateful for that. I'm part of a program from the Florida Alliance for Retired Americans and Medicare Rights that sends me out to talk to senior groups about all of these Affordable Care Act benefits that we can now get. And I find in talking to groups of seniors throughout the area, and I do this once or twice or sometimes 3 times a month, hearing really frightening tales from folks of what non-prevention does. And actually I have a neighbor who was suffering from, he had a knee replacement, and he had a hip replacement, and they never did any preventive care with him, and now he has stage 4 lung cancer. Had they screened him maybe, or had this Affordable Care Act been in effect years ago, as it should have been, he would not be suffering the way he is. He's suffering terribly right now. Because of my experiences with the Affordable Care Act and with this preventive screening, I've been able, I get my mammograms, I get everything, the bone density, obviously, whatever is available to me, they give me, and I take advantage of it. I'm just so grateful to be able not only to do it, but through Flora and Shine and Medicare Rights, to be able to pass this information on to groups all over the county.
Thank you so much, Joyce. And Cookie, one of the things that as a caregiver myself, we're talking about all these things, and I have found that caregivers need to be informed about these things so that whoever they're caregiving, they can make sure these things happen. Can you talk a little bit, because caregiving is what you're here to talk about?
Yes, I will. I have an aunt, she's 94 years old. She's in very good condition. She's very healthy. And, but I do believe in preventive care. She don't have any major ailments, but I do take her to the podiatrist. I take her to her primary care physician. I take her to the eye specialist. And without Medicare benefits, there's no way, that we can afford these things. And as a caregiver, it's not something that you plan to do. It's something that you inherit if you're willing to do it. And I'm just glad to have been given the opportunity to help my auntie. I never envisioned that I would be taking care of anyone, and then I look at my auntie and I say, one day I may be in her situation and I would like to be as healthy as she is. I just imagine if she wasn't healthy. It would cost an awful lot for someone to come in and bathe her like I do, and she assists me with that, to feed her, to put her on her clothes, to take her to her medical visits. It would be very, very expensive, and I'm just happy that I'm able to do that for her and she's able to assist me. So she's did a lot herself to prevent certain illnesses during her years, and I'm thankful for that as well. I just don't know what else to say. She's just in good shape, and I'm just happy that she's healthy. And I'm hoping that she don't break down, where we would have to take her to doctors and people would have to come into the home. And I just hope Medicare be around if that does happen.
That you just mentioned, Leo, that Medicare be around. One of the things that the Secretary brought out is the loss of so much dollars. Can you speak to that right now, and then we can come back to the conversation?
Sure. One of the things that our program focuses on is educating seniors, caregivers, healthcare professionals, people that we have up here on this panel, on what Medicare fraud is and how to prevent folks from becoming victims of Medicare fraud. Unfortunately, Florida is ground zero for Medicare fraud.
You had to say that.
We have a large population of seniors. What the Affordable Health Care Act has done is it has helped programs like ours provide proper funding to be able to go out and message the communities out there in Florida, throughout the state, on how to prevent becoming victims of fraud. So what our group does is we go out into various communities, and where money has come in and helped us out is in rural communities, where people said, well, I didn't know these benefits existed. When I talk to people about Medicare fraud, of course they always think I'm a Medicare expert, and they always ask me all sorts of questions, which I say I'm not. And I refer them over to the good folks at Shine, because they do a great job of educating folks on what their Medicare benefits are. But what I do tell them is, what I do ask them, are you taking advantage of those preventive services that are now covered by the Affordable Care Act? And a lot of them tell me no, or that they didn't know about it. So then I just say, talk to your doctor about it. Bring it up the next time you have a visit. And hopefully with preventive screenings, you'll keep yourself as healthy as you are in seeing me here today. So those are some of the things that the Affordable Health Care Act has done in helping us go out into the communities and educate them.
So Leo is part of a group, again, that exists around the country, the Senior Medicare Patrol. And it's really based on a theory that the best fraud fighters are not necessarily law enforcement, not necessarily district attorneys. I mean, they're good and they can do prosecution, but what we need to do is more prevention. And seniors and beneficiaries are actually the best front line of defense. So having this amazing group of a lot of volunteers and some trainers who really visit with seniors, talking about the importance, for instance, of not ever giving or sharing a Medicare ID number. In Moyo, I have to tell you that Florida may be ground zero, but not here in West Palm Beach. So it's just give you a little comfort. You know, because that's like credit card information. It can be used by fraudulent providers to set up a whole billing operation. You know, Medicare doesn't sell anything door to door. So if someone comes to a door or knocks on the door and says, you know, we have a deal, just sign here and share your information. I mean, those kinds of scams, unfortunately, are pretty rampant. And every time there's a change in the bill, we found, for instance, with the donut hole closing, that a lot of people were thrilled to find out about it, but then we had a lot of actual criminal activity around saying to people, I will get your discount for you if you just sign this paper. Give me your Medicare number and I'll make sure you get the discount. Again, nobody had to do anything because we watch the billings and it's automatic. But the Senior Medicare Patrol, which is being doubled over this period of time, is really boots on the ground, volunteers who are talking to their neighbors and friends. They go through a training and then they spread the word at lunch centers and meal sites and other housing projects and other areas to just say to people, you know, you need to be, unfortunately, a little vigilant about the fact that people may be trying to steal or get your information. You can be protecting yourselves, and they have been amazing in turning over fraudulent activity. The 1-800 Medicare number is still very much in place. You actually get a live human being at the end of that. It isn't a recording. Two things can happen if you call that number. If you have any suspicions of fraudulent activity, turning it over through that 1-800 number is now very much up and running, but also questions about individual cases. Someone at the other end of the line can pull up a case file and walk through answering questions that are very particular. So in addition to these wonderful folks on the ground, to our regional office folks and the SHINE who run a senior health information program, there also are assets available to get questions answered on a very special basis. But the Senior Medicare Patrol has been just an enormously important asset. One of the things in terms of fraud that the new tool that the Affordable Care Act gave us, some of you may have had a call from a credit card company at some point saying, did you purchase 2 flat screen TVs in Dubai? Is this because we don't see anything on your credit card that indicates you've been to Dubai recently, and is this yours? And I don't know if you've ever had that, but it's a credit card company is actually monitoring a billing practice and sees something that's very unusual, and before they pay the bill, they check with the customer, and then they never pay. If you say, no, that is not mine, they end up not only taking it off your bill, but tracking it back and trying to figure out who is fraudulently billing your activity. We now have built a system in Medicare where we can do exactly the same thing. It's called predictive modeling. And if you think about Medicare spends about a little over $1 billion a day with millions of providers. So there is now a data system built where people can watch claims come in real time and look at spikes in unusual activity. Home health care in one area is suddenly 4 times higher than it's been any time in the last 3 years. That's a signal. We then can get our teams on the ground to go take a look at, are really their home health agencies there? Are they physically, who's behind those doors? Who is actually, are there services being delivered? Are there real patients? And on a much faster basis, go after them. We also can, if the activity seems to be fraudulent, prevent those dollars from going out the door in the first place. You know, we used to be on the old pay and chase, so you'd pay the bill and then 6 months later try to figure out who in the world was the activity, and you'd never get the money back, and the criminals would disappear and be set up somewhere else. But this is a much more flexible system. So in addition to the wonderful volunteer activity, there's a much more sophisticated, and those tools were never in place and are really part of this effort to keep those dollars in the Medicare Trust Fund and make sure they're used for health services and not for criminal activity.
And I can tell you one of the important things, if you're a caregiver, is just to read the summary bill that comes at the end of the month, to see if there's anything on there. I didn't used to do it till we started talking about Medicare fraud. I'm embarrassed about that, you know? My dad just trusted me with that, and I didn't do it, but now I'm doing it, so it's very important. Dr. Coburn, I gotta come back to you because obviously the Area Agency on Aging is the leader of a large aging network. Here today, we wouldn't be able to do what we do if it wasn't for the service providers that are provided, by the way, under the Older Americans Act. A lot of the services are under the Older Americans Act. That was there when the Secretary's dad also, because that was created at the same time Medicare and Medicaid. But Dr. Coburn, one of the things that I'm excited about, the Affordable Care Act, is the bringing together the community-based services and supports that we're so grateful that they can be there because they save a lot of money. They help save, I know in this state, we have seen as advocates here that it's so critical to be able to keep those seniors at home, independent with dignity. And the longer you can do that, Cookie, like you'll be able to do, the longer we can help. And someday you may need a little bit of help. That's what the Older Americans Act does. Then we can, when it's time, then they can go into long-term care, institutional care. But Dr. Coburn, do you see the importance of community-based services supports as such as the Affordable Care Act is bringing forth, like care transitions and all of that?
Oh, definitely. I mean, to take care of a senior, particularly a frail older adult, it has to be a team approach. I can't do it alone, caregiver can't do it alone. So you need to reach out and know what's in the community and avail yourself of those services.
Secretary, is that really a key thing in your mind as you oversee this whole large network?
Well, we, under the Department of Health and Human Services, also is the agencies on aging and the Assistant Secretary on Aging. We have created, actually, Jaime, a new structure that's called the Administration on Community Living. Because the theory is that most seniors and a lot of disabled Americans want to live at home, want to be productive as long as possible, want to be independent as long as possible, and that isn't possible without a set of community services. So Cookie's aunt is very fortunate to have Cookie, but if Cookie weren't here and there weren't community service providers, she would have to make some tougher choices. Dr. Coburn's patient who was totally independent but then falls and breaks her hip. Without some help and support, she has to make some very tough choices. So building that network of community services and having those wraparound services, I think, is critical. It not only saves dollars, clearly, because being in a nursing home full-time is more expensive than being in your home with periodic help and support, but it's also what people want. It's what they would choose for themselves. So having that network of services, I think, is really important.
Joyce, you kind of look like you want to jump in.
Well,
Please do.
I was wondering, I know that as we progress into the future, we're going to be given additional benefits at particular dates and times. And I was wondering if there were any way you could just sort of give us an idea of when all of these things will come to us as additional benefits?
Well, Medicare itself is not going to change dramatically beyond what we have talked about, although we are currently updating on a regular basis based on the best information from providers, the kind of services that are provided. So there's a constant look at, hospice care, for instance, which was not really part of the Medicare benefit package 15 years ago because it really didn't exist, is now very much part of it and is being updated. So as services and supports change, the Medicare program will change along with it. Certainly for other folks, there are now different strategies about payments to doctors and hospitals. So not only preventive care throughout systems, but one of the strategies that's being tested, which seems to be pretty effective, is what's called a medical home model. So in a situation where, whether it's Cookie's aunt or Dr. Coburn's patient, having a team of medical providers, particularly with chronically ill patients or with somebody in a more disabled situation, where that team actually provides that kind of wraparound care at home as opposed to in a hospital or in a nursing home, and again supports a patient staying at home. So some of those strategies which seem to work very well to deliver better patient care and integrate that care will be updated on a regular basis.
Carol, please jump in.
Well, I want to talk a little bit about preventive care and the donut hole. I'm 77 years old, and I think I look pretty healthy.
You do.
But my history kind of reflects a different story. I've had 4 spinal fusions due to degenerative disc disease. I've had a tumor the size of an egg removed from my brain. I've had my colon removed due to ulcerative colitis. And then those were just the biggies. I've had a lot of other little smaller things that I've forgotten about. I'm sort of like the old Timex commercial, if any of you remember that.
I hate to say it, I remember.
It takes a licking, but it keeps on ticking. That's kind of how I feel that I am. And I bring all of this up because I'm really high maintenance and I require a lot of monitoring. And so I'm extremely grateful for the Affordable Care Act that allows me to have these services. I recently had a bone density test resulting in a loss, and so I'm on medication for that. I had an eye exam where they were looking for glaucoma, and they found something worse called Fuchs dystrophy, which is only curable by corneal transplant. However, I'm still driving without glasses, so I have that under control. I had an asthma attack recently, and I had all kinds of breathing tests that I had to take for my lungs. I'm scheduled for a mammogram later this month, and I've already had my pap smear, and I'm also scheduled for a stress test. So I need all of these things, and I don't have to pay a copay to get any of them. And I just don't know what I would do, as I don't have a paying job anymore, and I just have my Social Security. So it also means that there's a lot of pills in my cabinet. And it's no surprise that I have fallen into the donut hole. I take potassium because I don't absorb medications like those of you who have all of your plumbing intact. I take pills for depression because once in a while that comes down and floats over my head. I take pills for a treatable thyroid condition, and too many others even to mention. But I'm not paying any copay at all on the generic drugs that I'm taking, and I'm only paying 50% on the drugs that are not generic. And I can't tell you how grateful I am that this is available to me. But I imagine that I'm a really good example of someone who is taking full advantage of the Affordable Care Act. And the only way I know how to pay it back is I've recently become active with the National Committee to Preserve Social Security and Medicare, which goes hand in hand with the Affordable Care Act. And I too go out and speak to groups, educating them about these programs. So I thank you for it, and I hope I hope I'm still here in 2020 when that donut hole closes.
Secretary, you talked about myths. One of the big myths that's floating around the country, but definitely in Florida. And I received calls about this myself as CEO. And I had people saying, yes, but the Affordable Care Act is taking dollars away from Medicare. It's taken away, and we're not going to have the money to be able to receive things. Can you talk about that for a moment?
I'd be glad to. Because I do think that is one of the constant untruths that is part of the dialogue. And it started well before the law was even passed, and it continues on today. Part of the framework of the law with regard to Medicare is that no benefits will be cut in any way, shape, or form. In addition, as we've said today, in the last 2 years, benefits have been added for seniors. It is a more comprehensive program today than it was 2 years ago. And we look forward to that being part of the future. What is happening, and it is true that it is happening, is that the cost increases in the last 2 years are going at a slower rate, and that's very good news. So Medicare spending in the 10 years before the Affordable Care Act was passed was increasing at a rate of over 9% a year. Way ahead of inflation, way ahead of even medical inflation, going up at a very high rate. That increase has now slowed down a bit. Part of it is the effort on waste, fraud, and abuse that's put money back. Part of it is we are not continuing the overpayment of insurance companies for Medicare Advantage plans. Medicare Advantage plans are still very much in place. Every senior in every part of the country has a choice, but those rates have come down. And there are actually more benefits available now than there were 2 years ago. And part of the rates coming down is we have negotiated for lower rates. And that, again, is money that stays in the trust fund and is not expended. And those efforts have actually slowed the increases over the last 2 years from what was over 9% a year to just over 6% a year. Increases. So given the money that Medicare spends, just slowing down the cost increases, keeping all the benefits in place, making a more robust program, making sure docs are paid, as Dr. Coburn said, but trying to figure out strategies that actually are better for patients and cost less money has actually kept the spending at a lower rate. So when people talk about somehow taking money out, it's really, there is no taking anything. There have been no cuts in the program. It is slowing down the amount of increase by using strategies that really keep people healthier in the first place. So if you have fewer hospital days, because Dr. Coburn's patient doesn't go to the hospital or Cookie's aunt doesn't go to the hospital, that actually slows down the cost increases. If you actually have strategies which keep people healthier in the first place, prevent more falls, stop nursing home days, that actually keeps money in the trust fund. So that is actually, and what they have done when the act was passed is to project out the possibility of having lower rate of increases over a 10-year period of time. So this is not money that's coming out of anything. This is money that really isn't going to be spent. And we'll make sure that that's why when the analysts looked at what impact the Affordable Care Act would have on Medicare, what impact it would have on the trust fund, the analysts said the trust fund would actually have 8 more years of solvency based on the passage of the law, because money would be spent at a lower rate. It would still increase, but at a lower rate. So the notion that somehow Medicare has been cut, or Medicare has been hurt, or Medicare Advantage plans will go away is just nonsense. It's just not true.
That's fantastic. And that kind of brings us to a moment of closing here. And I want to thank the panelists. I want to thank you, Leo. I want to thank you, Joyce. Doc, thank you so much. Carol and Cookie, I'm really glad you made it.
Thank you.
Okay, let's give them a big, big I'm going to let the secretary say the last word here this morning, but I want to say something to all of you. We have here represented physician groups, we have hospitals represented, we have advocates, we have seniors, and we have providers. And I think what's important for us, because I know that every single person here, we're here because we care about seniors. We care about caregivers. We care about persons with disabilities. So we have to take it upon ourselves to pass the word. Let others know about it. We don't want to let anyone miss out on the benefits available through the Affordable Care Act. So that's our challenge, and that's our takeaway today, that I hope we will do that. Don't forget that after the session ends, we have Teresa Zayas, right back there in the back, and Jennifer and the Shine counselors will be over here to my left. And I have to say this to you, Secretary Sebelius. You've already done for seniors and caregivers the best thing that could have happened in your administration by having and making sure that somebody was the champion advocate for seniors and caregivers like Kathy Greenlee. I just have to tell you that. The Aging Network admits that. She is bringing us together with the medical community, mental health community, all providers, all a part of that. So I just wanted to tell you that and turn it over to you to close.
Well, for those of you who don't know who Jaime is talking about, Kathy Greenlee is the woman who is the Assistant Secretary on Aging, who now leads this new administration on community living. But actually, Kathy and I have worked together for years. She was an assistant to me and ran our consumer division when I was insurance commissioner in Kansas. She ran our senior health counseling program, so she knew that well. When I became governor, she became my Secretary of Aging in Kansas, and then people think I brought her to Washington with me. In fact, she was appointed Assistant Secretary before I was confirmed as Secretary, so she was well known and beloved in the aging community. So there's a great champion there, and she is terrific. You know, I think what Jaime said is a message that I would love all of you to take very seriously. Your voices are really important. You have powerful ways to communicate with neighbors and friends, with folks you see at church, with people you run into in the grocery store. And unfortunately, there still are a lot of misconceptions about what is and what is not going on. So we're trying to make sure not only to have conversations like this in beautiful West Palm Beach and other communities, but in areas all around the country. Because if people don't know what the benefits are, they won't take advantage of them. If they don't know what actually is available, it makes it more difficult. Yesterday I was in Jacksonville, and we announced a partnership that I think will also be an important piece of this conversation with all the big pharmacy chains. I was in a CVS yesterday, but CVS, Walgreens, Walmart, Sam's Club, Rite Aid are all going to be part of an effort that when a Medicare beneficiary accesses the pharmacy or even checks out getting some supplies at the drugstore, they're going to be giving information about what's now available in the Affordable Care Act, what kind of preventive care, what kind of discounts are available. And CVS is even running it on a checkout slip, so you'll get some additional information about making sure you know about your new benefits that are coming online. So the American Medical Association has been a great ally, not only in helping to pass the law in the first place, but in supporting and spreading the word. So thanks to Dr. Coburn and her colleagues, they have been terrific in terms of the word. The American Nurses Association, which is a very important care provider, have been really helping to spread the word and reach out to folks. So I want to thank you all for being here. I certainly want to thank the panel members for your specific information and experience. But those of you in the audience, I would just urge any way you can to have these conversations, because the more people understand what the reality is, how Medicare has changed for the better, what kind of benefits are now available with preventive services, a whole range without co-pays and deductibles, with an annual wellness visit, really important, as Dr. Coburn said, not to wait till there's a crisis, but actually come in and have a conversation and a checkup and make a plan for the future. You know, what are the issues that have changed from last year to this year? What do I want to work on? How can I get myself in a better situation? I think those conversations are always really important. And certainly the donut hole issue, that seniors need to absolutely understand that 50% discount in the brand name drugs is a huge amount of money. Over $600 on average per senior per year is real money in people's pockets, and they just need to not be afraid any longer that they're gonna run into this huge gap and have to stop taking what are often life-saving and certainly health-saving medications. So there's some good news to spread, and I'm just hoping that you'll help be part of the effort to get that word out. So thank you again, Jaime, for having us here.
Thank you. Let's thank the Secretary.